Thank you, Presiding Officer. And Minister, thank you so much for your statement this afternoon. Now, technology, without a doubt, is advancing at a rapid speed, with companies coming out with major developments to improve health outcomes. So I'd be interested to know, Minister, what, if any, tech device the Welsh Government is looking into to alleviate pressure on our health service this winter and going forward. The reason why I'm specifically asking this question is because I attended CES, the world's biggest tech conference, and managed to see some of these huge developments taking place in medical technology. Now, without sounding a medical rep who's come back from the States, one company that really stood out was one called MedOne Solutions, which actually has recently launched its MedOne device, no bigger than a mouse, which has sensors that can listen to your heart, measure heart rate, perform an ECG, listen to your lungs, measure blood pressure, oxygen levels, check temperature, and even listen to your abdomen. It can even look into your nose, throat, mouth and ears, as well as inspect your skin. Now, just this one device alone, Minister, has the potential to seriously change the landscape when it comes to providing healthcare from up close and afar, as well as alleviating pressure on our hard-working staff across the sector, including within hospitals, doctor surgeries, and even make life easier for paramedics as well. Now, patients with multiple health issues, the elderly, those with disabilities, alongside those who struggle to get out and about, would really benefit from this. I'm sure it's obviously a lot more intricate than what I've described here in front of you all today, but the main point I'm trying to make, Minister, and I may be sounding, like I said, like a medical rep now, but similar devices to this would not only improve outcomes for patients across Wales, but it would also alleviate pressure on our NHS, which is something you want to do and we want to see as well. Not just for winter, but all year round as well. As you've said, Minister, our health staff are under immense pressure, and it's going to keep on getting more challenging for us all. So it might be a long and complicated process to get something like this rolled out here in Wales, but Minister, will you commit to looking into this product and similar? And as I asked earlier, please can you kindly outline what other devices or tech solutions the Welsh Government is looking into to alleviate pressure on the NHS? And I'd really welcome the opportunity to talk with you further about this in more detail and provide you with contact details if you so wish. Thank you.
Thanks very much, Natasha, because I am absolutely wedded to the idea that if we are going to transform the way we do, in particular care, then we're going to have to rely more on technology. And I'm very much looking forward to going to see how the Delta system works in Hywel next week. So already some of this technology is being used in our communities. Certainly when it comes to care in future and doing care in the community, I think we've got to start by saying it's digital by default. And if you can't do it with digital, then you move into other areas. So I think it's really important. None of this stuff is cheap. None of it is easy. But I'm absolutely committed to this. And if you look at digital, then we are investing more per head compared to England. We're investing £18 per head compared to £11.50 per head in England. So we've got the Digital Priorities Investment Fund, £60 million. We have a digital medicines transformation portfolio as well. That's going to make sure that we have a rollout of transformation in relation to prescription and medicine in primary care by the summer of 23. We've got secondary care, amazing work being done already, but that needs to be rolled out. And then we'll have a central repository for all prescriptions so that everybody can know what's happening across the service. We have the Wales Community Care Information System that has been rolled out in most health boards now, and that was one of the objectives that I set for the chairs of the health boards. We have the National Data Resource, we have the Digital Maternity Record, we have the Welsh Nursing Care Record, Technology-Enabled Care Tech Cymru, give us advice on all of this. We've got the National Video Consultation Service that we've given money to. We've got the Welsh Emergency Department System, we have the Cancer Informatics Programme. The list goes on and on and on. So we are absolutely all over this space. One of the restrictions is that everybody wants these technicians. So we are competing in a very difficult market when it comes to this because, you know, everybody wants these digital experts and the NHS is having to compete in that space.